Good morning, everyone. This is Bill Keegan, Town Manager in Foxboro, with your latest COVID-19 update. So, taking a look at the numbers this morning, since March 15th, we've had 53 total cases in Foxboro. 27 have recovered, and currently 24 people have the virus and are being treated at this time. A total of 2 people are hospitalized, and 1 person has deceased as a result of the COVID-19 virus. Taking a look at what's happening in Massachusetts across the Commonwealth, there are a total of 39,643 cases. Total of 169,398 people have been tested as a result of that. In looking at Norfolk County, currently 3,960 cases are being are being treated. 263 deaths have been associated with the virus in Norfolk County. And across the state, Middlesex County is the highest case total with 9,253 cases, 8,314 cases in Suffolk County, which is Boston, and 3,960 cases in Norfolk County. Up in Essex County, they have the third highest number of cases, 5,296 cases overall. Right now, we have 18,100 COVID-suitable beds, 3,911 patients, and 1,053 ICU patients at this time, as we are in the middle of the surge at this time. Yesterday was supposed to be, based on the models, the biggest day for cases in Massachusetts, and so we're hoping to see that is a downward trend following yesterday's situation. The fatality rate, it looks like that the greatest area of the Commonwealth that has been impacted is in the age group of 80 years old or older. 1,100 people have in fact passed away as a result of the COVID-19 virus complications. 399 people from the age group of 70 to 79, 182 from the age group of 60 to 69, and from the age group of 50 to 59. Even though that's the largest group that's being impacted in terms of the virus, the number of deaths is actually relatively small. It's 63 when compared to 6,900, almost 7,000 cases that have occurred in that age group. So that is the latest in terms of the numbers in and around the Commonwealth and what's happening. Let's take a look at the New England cases this morning, since we have a few minutes to go over that. In around Massachusetts, of course, we have 39,000, almost 40,000 cases. In Connecticut, 19,815 cases, which is relatively small in comparison to New York, which of course is 253,000 cases and 18,653 confirmed deaths. New Jersey has 88,000 cases, almost 89,000 cases. Pennsylvania has 34,000 cases. California has 33,866 cases. If you take a look at some of the biggest states that have been impacted. In Rhode Island, there are 5,090 cases, 155 deaths. New Hampshire, 1,447 cases, 42 deaths. In Maine, at 875 cases and only 35 deaths associated with that. In Vermont is closely behind Maine with 816 cases and 38 deaths associated with the virus in those states. So that's the New England wrap up and see what's happening. Just on a worldwide basis, just to take a quick perspective of that, to give you an indication where the numbers are. It's obviously a very, very large number worldwide. Just waiting for those numbers to come up as they are rebooting the numbers. Okay, so it's nearly 2.5 million cases at 2,499,723 total worldwide. 171,718 total deaths associated with those cases, and as a result, the U.S. leads the world in terms of cases, bear with me one second, just it's reloading again for me. Taking a look at the cases, and the U.S. leads the world in terms of cases, total number of cases. Taking a little while to reboot here. Sorry about that. All right, I'll come back to that. So here we go. It's 204,000 cases in Spain, 181,000 in Italy, and 156,000 in France, 147,000 in Germany, and 125,000 in the United Kingdom. So 788. So the U.S. is about has about 4 times the number of cases in comparison to for all the things that have been going on. For all the cases around the world, it's about 4 times larger than any place else in the world. And I just got a note here to give a shout out to Ali Rodriguez for working yesterday at Gillette, passing out the food. Just a word and thanks to Ali and her team. They've been doing a terrific job, along with all the folks up at Gillette. And thanks to the Kraft organization as well for helping to sponsor this effort. But there is actually about 1 million meals that have been passed out to veterans across the Commonwealth based on the program that they put in place. They've been providing meals for like 2 weeks supply of meals for veterans who needed it. And nearly 1 million have been passed out, which is extraordinary. So we're really, truly grateful for all their efforts. And thanks to Ali for helping to lead some of that effort up there. And again, thanks to the Kraft Group for doing that as well. Let's take a look at what's happening on the report from around the state. And so it looks like for today's update, Governor Charlie Baker appeared on Face the Nation on Sunday. The governor spoke about the Commonwealth's COVID-19 response and the impact the pandemic is having in Massachusetts. He's also focused on community contact tracing collaborative and how important that initiative will be for the Commonwealth to get back on its feet and start thinking about reopening. On Monday, the state launched Pandemic Unemployment Assistance, which provides up to 39 weeks of unemployment benefits to individuals who are unable to work because of COVID-19 related reasons, but are not eligible for regular and extended unemployment benefits. So that program, as indicated the past few days, have been indicating that they would come out this month, and they have. They did come out as of yesterday to put that program in place. Anyone interested in following the program can go to mass.gov/how-to/apply for pandemic unemployment assistance. And OSHA has produced a guidance on preparing workplaces for COVID-19. It is available at www.osha.gov/publications/OSHA3990.pdf. And from the MRC email, I've given you all the numbers. There are 1,566 new cases from yesterday. That's trending downward, by the way, which is great news to see that, and it's consistent with what has been forecasted and modeled for Massachusetts. The new Department of Public Health has updated its daily reporting dashboard to include more detailed information on hospitalizations, demographic data, and county-by-county breakdowns. State public health laboratories and private testing facilities have now conducted over 169,000 tests for COVID-19. Over 7,000 tests were conducted in the last 24 hours alone. In healthcare, the PPE continues to be distributed across the Commonwealth. Hospital bed capacity, and as of April 20th, which is yesterday, 57% of the beds are available statewide in case they are needed based upon the surge and the impact on the state that way. Mobile testing at long-term care facilities. The state's mobile testing initiative continues, with the Department of Public Health reporting that 305 facilities have conducted 8,238 tests, with an additional 144 facilities receiving their own test kits to conduct another 14,602 tests through April 19th. UMass Memorial received FDA approval to begin trials of COVID-19 treatment using blood plasma from COVID-19 patients who have fully recovered from the virus. The hospital has opened a web portal to create a registry of Massachusetts residents who have recovered from COVID-19 and may be matched with COVID-19 positive patients for plasma donations. On the Unemployment and Worker Assistance Program, beginning yesterday, many individuals who are currently out of work due to COVID-19 pandemic will now be able to apply for the Pandemic Unemployment Assistance, which provides up to 39 weeks of coverage. Covered workers those are the folks that have not been able to receive benefits otherwise, but are now available to receive them. And all accepted applicants will fully receive the minimum weekly benefit amount plus the additional $600 federal pandemic unemployment compensation weekly benefit. Once a worker's wages are verified, weekly benefit amounts may increase. And currently, the system will be eligible to process benefits retroactive to the week ending March 14th, 2020. Eligible workers will be able to request additional retroactive payment back to January 27th once approved. To apply online, visit www.mass.gov/PUA. And under the small business category, the Small Business Administration is listing comments on a proposed interim final rule to allow for principal loan forgiveness to Paycheck Protection Program participants. Excuse me, the interim rule goes into effect April 15th to maximize economic benefits to small businesses, and public comment is open through May 15th. The Associated Industries of Massachusetts have compiled a central COVID-19 resource page for Massachusetts business owners. To learn more, visit amnet.org/COVID-19 resource page for employers. And today, the governor signed which was yesterday, H 4647, an act providing for a moratorium on evictions and foreclosures during the COVID-19 emergency. The legislation places temporary restrictions in place, limiting the ability of evictions and foreclosure proceedings to advance during and immediately following the COVID-19 state of emergency. And resources for residents experiencing job loss or income. COVID-19 is causing broad disruption to the economy, which is affecting incomes of many residents and families. There are a number of state resources and supports available to support workers who may find themselves unemployed or otherwise income constrained during this uncertain time. And I think that covers it. One last thing, I just wanted to remind people that blood donations are really truly needed across the Commonwealth. As you might expect, those donations are down due to the fact that a lot of facilities that normally take donations are not open due to the medical need on the COVID-19 front. So, but American Red Cross is actively pursuing that. So you can actually reach out to at redcross.org or redcross.com rather, and they will be happy to assist you with that. And also consider donating to the Mass COVID-19 Relief Fund to support organizations that provide key safety net support for people in Massachusetts hardest hit by the virus. Those are the latest updates from across the Commonwealth and what's going on in Foxboro. Again, continue to stay healthy and stay safe as we get through this. I had a COVID-19 task force meeting this morning, starting at 8:30, and provided the latest information what's going on across Foxboro specifically. Wanted to let you know that that our public safety folks are all in good shape. They're all doing well. They're up to full strength in terms for doing their work, and everybody's healthy, which is great news. So I'm glad to hear that, and everybody's doing well on that front. We are starting to look at plans on how we can re-engage. We're looking at May 4th as the latest date when the governor is actually looking to try and put people back to work. We fully believe it will be a phased approach, but we have no guidance yet on how that's going to work. But we're trying to come up with our own plans just in case to see how that will work from our end. We are continuing to work remotely, but we will hopefully get back into the swing of things during the month of May. We again want to be fully back to speed up to that point, but we certainly expect that going forward, sometime in May, we'll be getting back into the offices and reopening for business, at least on a maybe a revised basis, a reformed basis. But we certainly hope to be back up to speed then. So until then, I will be back with you tomorrow morning and provide you with further updates on what's happening in Foxboro. Anybody has anything they want to share, want me to share with them, share for the rest of the town. wkeegan@foxboroma.gov. It's wkeegan@foxboroma.gov. And until then, I hope you stay healthy, stay safe, and I'll see you tomorrow morning around 10 o'clock.